Good afternoon, North Dakota, and thanks for tuning in and thanks for your patience today. Happy Friday. I want to kick off with some gratitude. I want to lead off with thanking all of our legislators. We've had great collaboration with them throughout this entire event. Our office, between Lieutenant Governor Brent Sanford, myself, and our small governor's office team, we've had literally hundreds of calls and meetings with legislative leaders and leaders throughout the legislature that are involved in the decisions. And again today, I want to thank all the members of the budget section who supported the approvals made earlier this week on Monday by the Emergency Commission, which also holds a majority of legislators and the legislative leaders. Thank them for their fast action on moving through the coronavirus relief funds, which were issued to each state in an effort to help sure that we could get dollars to support the additional costs associated with this epidemic related to public health, public safety, and economic relief for individuals and businesses, and also making sure that we can keep the continuity of government going and doing that in a secure way as we move to doing more things through distance, whether that's education or whether that's general government services. So again, thanks legislators. They've been great partners through all this. They've been very active and very engaged, and I want to just thank all of them for their great work, and we look forward to working with them as we continue to navigate through this historic time in our state's history. Today, we've got a full agenda. We're going to talk about testing. Today is the day we're going to also, another topic would be the large group guidelines, talk a little bit more detail about the North Dakota Smart Restart. Of course, as always, we'll have a behavioral health section and a gratitude section, and we've got a special guest here today, Nick Hacker, who's the chairman of the board of the State Board of Higher Education. Nick, thanks for being here. A good chance to hear from Nick, and we talk about graduations at the university level. But today, to get started, I want to just start out before we get into the numbers to talk about the why. We have almost every single day began these conferences by talking about testing, and I think it's important to just revisit why we talk about testing, why we lead with testing, and why it's been important for the state of North Dakota to work its way to near the top of all the states in our country in terms of testing capacity. And the reason why we test and the reason why we want to test even more is so we can identify those people who are positive and have this contagious disease. And in some cases, we know that the symptoms of this disease can be really severe. I'm sure all of you have read reports about people that may be elderly or underlying health conditions who contract COVID-19. And this sounds, by all reports, to be a very challenging disease, particularly as many respiratory diseases are, where people are literally left gasping for breath. However, this same disease in young people without underlying health conditions may even be lack so many symptoms that they may feel like they've just got a cold or a little ache or a pain or something that they might not even think is something you can just shrug off and keep on going. And in some cases, people have tested positive, including children, that are asymptomatic and don't have any symptoms at all. But those people that are not really suffering from the painful threat or the actual, potential mortality associated with this can also be carriers. They can be people that are asymptomatic, but they spread the disease. And so this is a reason why we want to understand in our populations, and particularly as we work to protect our most vulnerable populations, and vulnerable populations include almost 20% of the people in North Dakota, people over age 65, people with underlying health conditions, whether it's coronary heart disease, whether it's lung diseases, whether it's people that might be going through cancer treatments and have compromised immune systems, whether it is people with diabetes, and we have a lot of that in our state. All of those factors increase risk for this. And then, of course, we take those individuals that may have those underlying health disease, we put them in close quarters, as we say, congregate living conditions like long-term care, or people that may be in shared housing, such as domestic violence shelters or homeless shelters or in our correction system, we add additional risk for spread when people have higher density. So when we talk about our vulnerable population, we're talking about all of those groups, and that represents about 20% of the state. And so for all of you that are out there that have been, doing a great job practicing North Dakota SMART guidelines as we open up and get back to head towards a new normal. Again, I want to thank everybody that's taking actions to help slow the spread of this potentially deadly virus by following the North Dakota SMART guidelines, because you may be saving the lives of your own loved ones, or by stopping the spread, you may be saving the lives of someone that you've never met who might be living, for example, in a long-term care facility. So that's why we want to test, because when we test, we identify where they are, whether they're asymptomatic or not. We can trace their close contacts, which might be people that are in the same household or people that they work with, depending on the work environment. And then we can isolate or quarantine those cases. And we do that, we have an opportunity to arrest the spread of this virus, and we can do that in a way which is our ultimate goal, which is to save lives and livelihoods. And if we can test, we can trace, and we can isolate, if we can do that in a targeted fashion, we can do that way, then we have an opportunity to allow our economy to open up. And so that's why, again, it all begins for us with testing, and this is a core skill and capability that we're going to have to build as a state, and it's something that we're going to have to get better and better at, not just as a state, but as organizations, schools, businesses. Everybody's going to become a lot more familiar with testing as this year goes on. But let's jump into the numbers. Now that you know why we start with these, we've added some more numbers to our slides today. When I reported yesterday, we were moving towards an additional level of clarity around the underlying test numbers. We talk a lot at the state of North Dakota about growth mindset. We talk a lot about one of our values is curiosity. And I would have to say it was curiosity as we kept digging to try to understand more about how the CDC wants numbers reported and more about how our systems work within the state as we've scaled them up. And so again, for the public, we're adding more additional level of clarity here today. The numbers on the slides, let's just walk through them. 52, that's the number of positive cases for today. Cumulative positive cases, 1761. Again, that's a less interesting number to me because, as we'll see later, majority of those people have recovered out of the positive cases. We want to focus on active, but on this slide, that's the cumulative. The tests that were completed during the 24-hour period, beginning midnight to midnight yesterday, Thursday, across all of our labs was 2,310. And so the percent positives of the 52 over the 2310 is 2.3%. And again, that's a number that's important for us to have on our own operational dashboard here at the state, because that is a number that helps us know, because we are, with our targeted testing that we're doing, when we're identifying positives, identifying those who are in close contact, inviting them to get tested, we're actually out trying to locate additional positives. So when we've got a focused, targeted testing plan, and we're still only coming up with 2.3% positives, that is absolutely great news for the state of North Dakota. We reported yesterday that we had topped over 50,000 tests. We want to make sure that we're clear on that. The state of North Dakota has now tested 51,311 individuals. Because we have many people, including healthcare workers in regular medical settings. We've got people who've worked as healthcare workers in long-term care. We have residents of long-term care where we've had outbreaks who've been tested multiple times. And so when an individual is tested more than once, they're not included in the 51,311 number. But the number of tests that have been run by all of the dedicated people in our labs is close to more than 9,000, or close to 9,000 above that. So 60,492 tests have been completed. And then if we take a look at all the tests that have been run on individuals, the 5131, and as a denominator, on the top of that, the 1761, which is the total cumulative number of positives. That's the individuals who tested positive and the individuals who've been tested regardless of how many times they've been tested. That gives us that 3.4% rate that we use for we use in our tracking for the when that's the 3.4% is the percentage of individuals in our state who've tested positive. So again, went into a little more detail there today because we're sharing the new data, and the key thing to remember is we've got individuals and we've also got number of tests run, and we want to be clear on that. When we take a look at this in terms of serial testing, which is a new word we've introduced this week, we'll take a look at that slide. In the lighter green, this represents individuals that were tested on the serial testing on the green top. The darker green represents tests that were run on people who'd already been tested prior. So when you add those two numbers together, that's when you get to the testing related to what's going through the lab. And again, when we have days like yesterday where we did 906 serial tests, so 906 of the tests were concluded yesterday were related to people that had already been tested prior. So again, 2,310 tests were conducted yesterday. 1,404 of those were newly tested North Dakotans, because of course we are doing testing cross border. Whether they're Montanans or South Dakotans or Minnesotans, and now doing more testing in Minnesota, but all of that data is stripped out of this. The numbers you're seeing represent only people who have North Dakota addresses. But again, you can see in that growing darker bar that the serial testing is becoming a bigger portion of what we're doing, and that's going to make sense. We're going to have more of that as we focus our testing on going into areas where we know there's been presence of the disease, and we want to work our way through that. When we take a look at the net case breakdown, again, we are sad to report that the deaths have climbed by 2. We've had 2 additional deaths, and resulting now in 42 North Dakotans, but a man in his 40s from Grand Forks County, a man in his 90s from Cass County. Both of those individuals had underlying health conditions, and as always, from the First Lady and myself, and from Lieutenant Governor Brent Sanford, our hearts go out to all of those who've lost someone during this pandemic. In terms of the active cases, we want to take a look at that on case trends. Again, on this thing, you'll see that our recovered cases just a week ago, those lines crossed, but this is exactly what you'd want to see on a chart like this. The light green line heading upward is the number of people who've recovered. So now over 1,000 people, 1,071 to be exact, have recovered. Active cases at 648 is down slightly from yesterday, and that's great news because we see that is the 648 active cases. That's what we actually have to deal with in terms of our medical community. At 3.4%, which is our cumulative positive rate, that remains, as it has been, the 5th lowest rate in the country. And again, on the hospitalizations, 35 people hospitalized. That's down 3 from yesterday. That's good. And again, on I think we're going to come up here with the positive rate over the 14 days. Again, we like the way this slides. This is our 14-day rolling average. Today's rate is 2.4%. It's up slightly from our low of 2.1 at the beginning of the week, but it remains relatively flat. And again, we would expect this to climb slightly because of all the targeted testing we're doing, again, as we're out really trying to locate and to contact trace and isolate those positives. We would expect to see that we're going to see some increase in the positive rates. But all in all, great numbers, particularly when we see that that actives, decreasing by 17 from yesterday, hospitalizations down, and number of recovereds climbing nicely. So a lot of hope for us, but we know that one of the challenges that still remains for us is in Cass County, and that's why we we're seeing the majority of our new testing coming there. We will provide regular updates on the efforts going on in Cass County as part of the Red River Valley COVID Task Force. And again, as you know, that we are teaming up with Minnesota and working with Cass County. Cass County alone has had more than 1,000 positive cases. They've had 572 recover, and they've had challenges there, of course, in congregate living on the Minnesota side. And we're, again, offering to collaborate, coordinate, and help in any way we can because that's all part of a metro area, single metro area. And our neighbors in Minnesota that may live and reside in Moorhead but work in the North Dakota side, we want to stand beside them through this as well. And we know that this is a battle where the virus does not recognize the river or the border when it's in a metro area, so we have to have a coordinated approach. So again, thanks for everybody, the mayors on both sides of the river in both counties and county health departments. Thanks for everybody for all the work they're doing and will continue to do over this weekend as we work nonstop to try to slow the spread in Cass County. When we flip to the next topic, which is related to the North Dakota Smart Restart, we said, as promised today, that we'd be releasing the protocols for large gatherings. I want to thank the North Dakota Department of Commerce, who's worked with business and industry to collaboratively develop these recommendations for the North Dakota Smart Restart related to event centers and other venues, also working in collaboration with the North Dakota Department of Health. As has been the case throughout all of this on anything related to North Dakota Smart Restart, our commerce team has embraced public-private partnerships and private sector input so that we can work to help those that have been affected by this pandemic in the best way possible. This, I want to give a shout out to Commerce, of course, Michelle Comer, who leads Commerce, who had a chance to travel along to the White House this week, and she did a fantastic job in our meetings there. I want to also thank Sarah Otta Coleman, who is leads tourism for North Dakota, but has jumped in to lead this work group, and a long list of terrific people. Many of these names will be familiar to you, and are associated with some of our largest gathering spaces and places in the state. But Jody Hodson from the Ralph Engelstead Arena, Randy Hotzenbuehler, and Justin Fisk from the Theodore Roosevelt Memorial Foundation, which of course leads most of the things going on in Medora, including the Medora Musical. Rob Sobolik, longtime great leader of the Fargo Dome and all the great events they have there. Charlie Jeske, same way, Bismarck Event Center. John Cram, Shields Arena. Anna Roseberg from the Alaris Center. Dave Schneider from Prairie Knights Casino. Christy Mischler from Frostfire Summer Theater up in that beautiful northeastern part of our state. Whitney Baumgardner from the Fargo Forest. Deb Belquist, who's done great things for the arts her whole life from the Dakota Prairie Arts Council and the Rockford Theater. John Bollinger from the Bismarck Larks. Tristan Moss from Marcus Theaters, Ryan Angus from Aggies Theaters, Joe Gutting from the Avalon Events Center in Fargo, Lisa Hickson Molston from Regency Management, which operates a number of hotels. So I want to thank all of these business leaders for their voluntary participation to this diverse work group, which covered the geography of our state, as they work to recommend protocols to balance the importance of controlling the spread of the infection with the ability to safely proceed with events going forward. And those events, of course, may start with more limited in size and additional precautions, but all of this is on the path as we learn how to operate in this new environment. And again, unlike some of the industry standard specific standards that were required by executive order under the North Dakota Smart Restart Plan, the ones that we're talking about today are recommendations, only recommendations. And so again, we strongly encourage venues to follow them. They were developed by your peers, and we are amending the Executive Order 2020-06 to reflect this change for recreational and sports arenas and for music and entertainment venues. As always, when people say, well, wow, if these are just recommendations and people don't really have to follow them, what good are they? Well, we know that there's been a strong demand because the owners and operators of these venues really care about the safety of their own employees, their own team members, and they care about the safety of those individuals that would be attending their events. We also, as we talked about back on May 1, as we were getting ready to reopen bars and restaurants and personal care businesses in North Dakota, we asked again in the same way that the customers were part of the positive force to help us open safely, because customers have a right to choose on everything from where they might get their personal care services done, to where they shop, to whether they go, which restaurants they may go out to eat or not. And so those market forces, again, I think will help guide whether you're a small, very small bar or restaurant, or whether the largest venues in the state, will help guide them in terms of making sure that their customers and potential customers and visitors or concert goers or people that might be going to an outdoor baseball game, that they're also feeling safe and comfortable. And again, we also reflect if we've got people in these environments that want to come out, understand that if you're young and healthy, someone else may be there that may be feeling more vulnerable, or they may be living with someone who's vulnerable. So again, let's support and be supportive of anybody that might choose to wear a mask in any of these venues, because that also is something that can help protect them and their loved ones. So under this large gatherings guidance, we're going to talk a little bit more today about what the different phases are, and we'll be talking about a sort of a five-level model. But in the five-level model, we're in the middle category, which is moderate risk, which means that we have to still be alert. We have to be in a heightened risk for exposure, but understanding that transmission is generally controlled. And under the moderate risk guidelines, the gatherings in these facilities can be up to 50% of their certificate of occupancy, or up to 250 people. Gatherings of any size shouldn't be held if proper distancing cannot be maintained, and food service within these venues must still comply with all the North Dakota Smart Restart restaurant and universal standard protocols. When we move to the lower risk, then occupancy increases to 75% and no more than 500, and under the new normal, which would be our lowest level of risk on a 5-level scale, then most activity can resume. Festivals and sporting events where proper safety and guidelines would proceed. And again, as we move down those, we'll provide more details. Again, right now we're talking today about moving to phase 1, and the key here is that as we're in phase 1, that we need to reduce transmissible moments. That's what we're really trying to do, and this is going to take common sense as well. And we would encourage those venues to do all the things that other businesses have done, and whether that's thinking how you think about separate entrances and exit streams, so people aren't going face to face against each other when they're coming or going, having contactless payment systems, again, where if you can do this with scanners and barcodes off people's phones, where you don't have to be exchanging physical tickets, or people are touching the same objects in restrooms. Again, if you can go to touchless faucets and touchless doors, those things will help avoid those areas where there might be transmissible moments among large groups, because we do know from an epidemiologist standpoint, large groups represent real risk, because if you've got a highly contagious disease, it only takes one large group, say even if it was in a county where we haven't had a single case, if someone came from outside that area and attended that event, whether it's a wedding venue, a funeral, or a concert, when you get large gatherings, as we've seen from around the nation and around the country, from those large gatherings, you can have very rapid transmission. We know that we have no plan will eliminate risk. We're about managing risk and managing risk in a smart way, where we can both we can save lives and save livelihoods, both of those things. But we are in a position as a state right now to take on a little more risk relative to the virus, because by taking on some risk, we know that we have proven that we've got the capacity to deploy both testing and contact tracing to help us arrest the spread if we do have an outbreak somewhere in the state. So guidelines, there's additional guidelines for banquets, ballrooms, weddings, event venues. These will all be posted later today, or hopefully again before midnight tonight, but ndresponse.gov. I know they're just putting the finishing details on them probably right now as we're announcing them. In addition, today we do want to talk about version 1 of our North Dakota Smart Restart Plan, which I mentioned. This was prepared by the North Dakota Department of Health and our Economic Resiliency Team, led by Commerce in conjunction with the Governor's Office, and this was developed from input from statewide industry groups. And this provides a little more structure to and a little more understanding of how we're thinking about continuing to move towards the new normal. And again, this reactivation can only occur if North Dakotans follow the public health guidance which we've issued under the North Dakota SMART guidelines, but also, and people are doing fantastic so far, but also again exercising individual responsibility. This road to recovery will progress gradually as all of us sort of again dial up the interactions in our economy, and then we monitor and see how that's all working. The report, as you see here, this might look familiar to people, particularly if you've traveled out west or live in the western part of the state or live near any of the USDA national grasslands, because you might see a chart like this related to fire danger. And what we're have here on this sort of 5 level, we've got the critical, high, moderate, low, and new normal. We're today, as a state, in the moderate level. We have, earlier in this crisis, we were in the high risk because we didn't have all the capabilities and skill sets that we've talked about in terms of the test, trace, isolate capabilities. We didn't have that, and so we were in the high. We knew less. We were unsure about our healthcare capacity. That we've really taken care of, and we know that we've got plenty of healthcare capacity. Other states in the nation were in that critical category. The good news for North Dakota is when we look at the criteria, we were never in that spot. We were never out of healthcare capacity. We were never out of ICU beds. We were never out of ventilators. We were never in that risk spot. So we started in high, we've moved down to moderate. Our goal, working together with all of you, with the great individual responsibility and people exercising their freedoms in a way that's respectful to those around them, we can continue to see ourselves, confident that we can continue to see ourselves moving forward and moving into the level of the green. And the other piece, as we talk about this too, as you'll see when we release the full guidelines tonight, we have reserved in this the capability to drill down to the next level, what I'll call county by county, because we have had very different experiences. We have some counties still that have not had a single positive case during this entire pandemic, and others like Cass County, where we've got a focused task force right now trying to arrest the spread in that county. So going forward, weekly, we will update where we stand on the risk levels, and that will drive different stages of economic reactivation. And we have, I want to say, have the capability in this framework to set the dial differently on a county by county basis or on a regional basis. And as we get even further down the road, we would have the ability to potentially even do this on a city by city level if we're going to become even more granular. But for right now, we are declaring that the entire state is in this yellow, or I guess it's slightly orangish yellow here color, but the moderate, we're in the moderate level, and with those guidelines comes, that we've just announced, comes the loosening up of group sizes for events. And again, more details online. As we move forward, of course, it's important, as we say, that North Dakota SMART, the basic guidelines we have for everybody about practicing hygiene, keeping physical distance, wearing masks where appropriate, and keeping surfaces clean. All of that still applies, all of that great work. If you're in one of those counties that has no or a few cases, one of the ways you can keep it that way is continuing to practice North Dakota Smart. And if you're living in Cass or Grand Forks County, I think, again, there should be enough awareness there that very important for people in those areas to really be paying close attention to the North Dakota Smart guidelines. The next topic is behavioral health. Or actually, no, the next topic is actually voting, I think. Isn't that what I'm seeing coming up here? We talked a little bit about this again on Wednesday about how to, cast your vote by mail and how in the June election was coming up. We got a lot of questions coming back and a lot of things coming into our office. We want to do kind of a quick refresh for this. The executive order gave counties the choice of conducting mail ballot voting or setting up a physical polling place or both. All of the executive order did was establish local control, so counties could decide. We have always had in place in North Dakota law the ability to do mail-in voting for a county. 33 of our counties did that. Prior to this, 33 out of 53. And those 33 under prior law had to maintain at least one physical polling place. There was also a criteria for how many days in advance that you had to set up and identify where those polling places are. In the executive order that established this local control allowed a county to go to mail-in only. All 53 counties, back when they made the decision, decided they want to do that. If you live in a county where you believe there's almost no health risk, and if you can execute it in a way that is safe, then talk to your county commissioners, because our reading of the existing law and the executive order today is that if a county decides that they want to have a polling place or two polling places in addition to the mail-in, a county could decide that on a county-by-county basis. So again, stay tuned on that, but right now that's a local decision. We appreciate all the calls and questions, but talk to your county commissioners. If they've got questions, we want to provide the flexibility. I mean, our overall goal here is to make sure that every single eligible voter in North Dakota, whether you're in a city, whether you're in a rural area, whether you're in a area of higher breakout, lower breakout, whether you're an enrolled member of a tribe, wherever you are, if you're a eligible voter in North Dakota, we are working hard to make sure that you've got the ability to vote. And on that note, also, I know that the North Dakota Department of Transportation has announced that they're beginning setting up going mobile sites to help with tribes in terms of helping people get tribal IDs in a mobile way. And so again, our great collaboration going on between the state of North Dakota, Secretary of State's office, NDDOT, and others to make sure that people are prepared and ready to vote. And of course, everybody, if you have got concerns, if you're elderly and got underlying health conditions and you're concerned about going to a poll, or if you're a poll worker who doesn't want to volunteer, that's why we've got the ability here to cast your vote by mail. And there's 3 simple steps. One is you've got to send in an application to get your ballot, and you can't email it in. You have to actually physically mail it in. You can go online and fill it in and print it off. You can go online, print off a form, fill it in by hand. You have to mail it in. You'll get sent a ballot, and then you return that ballot by mail, or you can return that ballot to a drop box. And if some counties choose, there will be some counties may choose to have a polling place open. I'm sure they'll figure out a way to do that with social distancing and perhaps younger or non-vulnerable poll watchers that are able to be there that day to make sure that this happens in a very safe way. Okay, that's the voting update. Next update is I thought was going to be behavioral health, and then we'll do that, and then we will jump to graduation after that. But on the behavioral health front, we do know, we've said it throughout, we've kept a section every time in this, as North Dakotans are getting back into their familiar routines, and many people are practicing social distancing, and by doing that, they're having reduced interactions with family and friends. And if you know someone who's struggling emotionally or having a hard time, you can be the difference in getting them the help they need. And there are 5 steps everyone can take, and this is if you see someone, again, that you think is sad or anxious or depressed, those could be early signs of someone that may even be thinking about taking their own life. And so the first thing you can do is just ask. Ask someone how they're feeling. Ask them if they've had thoughts about suicide. Get that conversation out into the open. Keep them safe, be there, and then help them connect with professional help and follow up. Additional information on these 5 steps, including how to talk to and support someone who's under stress and at risk, what the warning signs are, what the action steps you can do, and links to connect with behavioral health services in the state and other resources are all available at behavioralhealth.nd.gov. If someone is really struggling, talking about feeling hopeless, withdrawing, behaving different than usual, showing warning signs that they may be thinking of suicide, that's not the time to talk to someone else that you're concerned about them. That's the time to talk to them directly. You can save a life by being very direct and just ask them if they've had thoughts about taking their own life, and talk to them, help them find help. And call the Suicide Prevention Lifeline at 1-800-273-8255. And again, continue checking on each other. Take time this weekend to reach out to a friend, a family member, a neighbor. You can be the difference. And remember to take care of yourself where you're supporting others by yourself getting enough rest, eating healthy, and connecting with others. Everyone's behavioral health is important, starting with you. Next up, we want to talk about higher education graduation. And of course, prior to the COVID-19 emergency today, May 15th, and tomorrow, May 16th, many of our higher education students across the state from our 11 fantastic state institutions would have been participating in their formal in-person commencement ceremonies. If you've ever gone through one of these or attended one of them on behalf of a son, a daughter, a niece, a nephew, or a loved one, or even a parent for older than average students, you can know what a thrilling, emotional thing is for people that have committed for years to attain these degrees. And each of our colleges and universities have made plans to reschedule or revise planned commencement activities, whether through virtual commencement ceremonies this week or face-to-face events planned later this summer or in this fall, or in conjunction with some coming back next year if we can have 2021 commencement exercises. This weekend, virtual commencement activities will be hosted by Bismarck State College, Dakota College at Bottineau, Lake Region State College, Williston State College, Dickinson State University, Minot State University, and the University of North Dakota. And as you know, graduation is an incredible milestone and achievement in an individual's life. And today, on behalf of the state of North Dakota, we'd like to recognize the approximate 6,500 students across the North Dakota university system completing their degrees this semester. 400 students will be completing degrees of 2 years or less. 1,400 will be completing associate degrees. 3,700 students completing their bachelor's degrees. 750 students will complete their master's degrees. And I bet you didn't know this, but there's 350 students in North Dakota that are going to be completing their doctoral degrees this semester. I want to say to all 6,500 of you, you've each demonstrated an inspiring amount of commitment, resilience, and passion through your educational journey, particularly this past semester. You'll remember your spring semester your entire life, I'm sure, the one that was disrupted and transformed by a global pandemic, but that makes your achievements even all the more impressive. Many of you may have left campus for your spring break, thinking you're going to be gone for a week or 10 days and coming back to finish up and enjoy that final, the feelings of the final months on campus with your friends, only to learn that those plans would change and that we were moving towards distance education. So if you've made it through this, you've transitioned to distance education, you've continued learning and growing about yourself, as well as about your degree during these unprecedented times. And I want to say on behalf of Lieutenant Governor Brent Sanford and myself, congratulations on this important achievement, and thank you for being fantastic ambassadors for North Dakota. We wish you all the best on this new journey. And of course, navigating through all of these challenges has been our State Board of Higher Education, and again, our chair, Nick Hacker, doing a great job leading the team and leading all of our educational institutions during one of the most tumultuous times in the history of higher education in the state of North Dakota. We're great to have him here in person, Chairman Nick Hacker. Welcome, Nick.
Good afternoon. Thank you, Governor. Thank you for your steadfast leadership and support of higher education through this, as you put it, tumultuous time. And thank you so much for recognizing the hard work and success of our 2020 spring graduates. This is really a great time for us to celebrate. The safety and well-being of our students, faculty, and staff is really our number one priority. And we want to thank the students, faculty, and staff for working together and literally turning higher education on its head in a matter of weeks to transition 11,000 face-to-face courses to alternative delivery formats, primarily online. And we look forward to new opportunities ahead as a result of this, although disruptive, but positive change and our ability to adapt and be flexible into the future. Our job is student success and supporting the needs of the state of North Dakota by developing the next generation of leaders, educating our citizens, and meeting workforce needs. I won't recite the numbers that the governor put up, but I do want to add of our annual 11,000 degrees awarded, 6,700 ballpark happen at this time. And I would add that a third of those are certificates and degrees awarded to career and technical fields, associate degrees effectively and less. And so we are laser focused at meeting and solving the workforce challenges of the state of North Dakota. We are truly dedicated to being a part of that solution. One of the high points of each semester are our commencement ceremonies that serve as a milestone to show the success of our students, even if virtual. In fact, Bismarck State College's virtual commencement began this afternoon at 2 o'clock online. You can find many of these online commencements. 6 institutions are doing online commencements. The rest are all delayed into the summer or fall for their in-person commencement ceremonies. But you can find them generally online at the institution Facebook pages that are really being broadcast well across the internet. So exciting time. And it's a really fun time, too. We found some great ways to add some joy with some really great special guests like Josh Dumel and Miss America Kara Mund. So we thank them for coming back and highlighting our students as well. Over the years, we've been able to watch as our students, campuses, and institutions adapt to ongoing change. And this year was clearly no exception. But together we stood up, we got the job done, and through hard work, dedication, and finding innovative solutions by coming together as faculty, staff, and students, we got it done. Thank you to the students and families for putting your trust into North Dakota higher education. We applaud your students and the students' accomplishments, and we are confident that that education will give you a competitive edge in your career and life. Congratulations to the graduating class of 2020.
Thank you, Chair Hacker, for your leadership and great work on the board. I want to say again, one of the key responsibilities of the Board of Higher Education is helping to lead, guide, and hire our university presidents. And great work. We've got 5 new university presidents. What an interesting time to become a university president. So Dickinson State, Bismarck State College, Mayville State, Valley City State have all had new presidents. And of course, we welcome the new incoming president to UND. But 5 out of the 11 brand new, but I'm sure interesting time to be a new university president and an interesting time to be the chair of the board. So thank you, Chair Hacker, and also I want to thank Chancellor Haggerat and his whole team for all the work they're doing here at the system headquarters, if you will, for the work they're doing to lead higher education through this time. We also know that graduation is an important achievement for our students, but it's a meaningful event for the family and friends as well. And so whether you're participating and watching today virtually, or whether you're just writing a card or a note, I want to say thank you to all those families and friends that are taking time to share their support and their congratulations with these hardworking graduates. And I want to also take a moment and thank all of the faculty and staff across all of our university system, because this has been a super challenging time. personal relationships built up between faculty and staff over the years, disrupted by distant learning. And then also there's 11,000 face-to-face courses that are offered by our university system, and all of those moving to alternative delivery formats. And so again, for the teachers and in faculty and instructors and the staff and all of the people in IT that work to support this at the university level, we appreciate your flexibility, your dedication, your perseverance, your innovation, and your commitment, as Chairman Hackett said, commitment to student success and your commitment to building world-class educational offerings and institutions here in North Dakota. So thank you, Higher Ed, for all the work you've done to get us through this pandemic so far. Keeping up with the good news, on here we shift from higher ed back to high school. We had talked earlier about an idea for doing a statewide virtual, and I want to say, and again, that congratulations to Superintendent Baszler and her team for pulling this really fun idea together. 2 p.m. Central on Saturday, May 30th, 2020. So 2 p.m. Central Time on Saturday, May 30th in this year. Superintendent, we're going to have Carson Wentz, Josh Duhamel, and Tiger Lily, the award-winning Nashville Music Act, and these are all recent. I guess Josh not that recent, but Carson and Tiger Lily, a little more recent in terms of graduates from North Dakota high schools, will participate in an hour-long ceremony. Included in that there will be a selection of 5 graduates that are part of the senior class. So senior students from seniors in high school from 5 different North Dakota schools are selected to be part of that. And so again, I want to say again, thank you. So Kendra and Krista from Tiger Lily, Joss and Carson, they're going to have words from all of them, a performance by Tiger Lily, and nearly all the high schools in North Dakota have contributed pictures of their students to be displayed during the ceremony. We're grateful to everyone participating in this and to the media partners that are going to be carrying it statewide. We know that this statewide virtual ceremony is not intended to replace individual high school graduations. We know that with the guidelines that we released a couple of weeks ago or about 10 days ago, we hope that there'll be additional opportunities to celebrate graduates' successes. And of course, for many families will be holding events in their own homes. And again, we know that they'll be practicing North Dakota smart approaches to those graduation celebrations they're having for their seniors. And again, this emergency has upended many lives and traditions, and as we adjust to new approaches, we're pleased with this virtual statewide star-studded graduation that we are happy to find one more way to celebrate and support our students whose passion and resiliency is making a difference for North Dakota. Lastly, I want to close with gratitude. And I want to say again, one of the great things, there's so many things to be grateful about in terms of living in North Dakota, but one of those is that whether it's emotionally or physically or even statistically, if you're into data, North Dakota is a very safe place to live. And it's in no small part to the fact that we've had, since our beginnings as a state, a really dedicated and capable law enforcement community. And we're thankful every day for those individuals, regardless if they're at the local, at the city, at the county, the tribal, or at the state level, that we've got people out there on the front lines every day, keeping our citizens safe, investigating incidences, bringing lawbreakers to justice, and building relationships with community members and students to create a safe environment for people to thrive. During Police Week, and particularly today, which is Peace Officers Memorial Day, we recognize those brave men and women who've made the ultimate sacrifice. Each year, there's a ceremony here on the Capitol grounds at the Peace Officers Memorial. If you ever had a chance to visit that memorial, it's tucked away just east of the J-Wing building in a beautiful grove of trees. Each year there's been a ceremony. I've been honored to be part of those in the last several years. And it's got listed there, engraved in stone, those heroes whose lives have been taken in the call of duty when they put themselves in harm's way to help protect and save others. We owe these individuals our deepest gratitude for their selfless devotion and sacrifice, and for their unwavering bravery and dedication that they demonstrate on a daily basis by all the men and women in law enforcement. This year's public memorial service was canceled due to the current COVID-19 health restrictions, but our state has fallen. We're honored today as chaplains from the crisis care chaplaincy read the roll call of all North Dakota's 64 fallen officers in a closed service at the Law Enforcement Memorial. We will never forget the names of our fallen or their sacrifices. We will always honor law enforcement officers for their service. If you see someone in uniform today or in the coming weeks, take a moment to say thank you to them, because they have kept working tirelessly through this entire pandemic, and we are grateful for them. In closing, on a gratitude quote, comes from now 91-year-old author Joanna Macy, and she says, "In times of turmoil and danger, gratitude helps to steady and ground us. It brings us into presence, and our full presence is perhaps the best offering we can make to the world." And so again, as we close the formal remarks for today and head into Q&A, I want to say to all of you, again, grateful to each North Dakotan, particularly those that have tuned in and listened to these programs, because your information, your awareness, your presence during these briefings has helped, again, calm our state and help guide our state. And we're grateful in these times of turmoil and danger. We're grateful that you have helped steady and ground us. So thank you for that. We'll be back not Monday at our normal time, but we're having our first one next week at 3:30 on Tuesday. We've been announced there's going to be a video teleconference with the President Trump and First Lady Melania, which the First Ladies of the nation and governors are invited to. That's going to be happening during this time on Monday. And so we'll be, barring any emergency that would cause us to have a press conference either before or after that meeting, we'll be here for our regularly scheduled 3:30 Tuesday briefing. With that, we'll stand for questions. And again, Chairman Hacker is also available for questions. We're going online first today for those of you that are regular attendees. Thanks for your patience.
Todd Hennon, WZFG KFYR Radio. You and other elected leaders have talked to Seema Verma as a follow-up to your White House visit this week. Do you expect waivers from CMS to allow for better access to families at congregate care facilities?
So question from Scott. Yes, we had a great call as a follow-up last night with Seema Verma and her staff. We also had Doug Holscher, who's a senior advisor from the White House, that was on the call. Chris Jones, Caprice Knapp. Caprice is the Medicaid director for the state of North Dakota, and Chris Jones, who leads Human Services. And we had a great discussion about a number of specific areas where we were looking for either clarity on guidance relative to transfers in and out of long-term care, and also a broader discussion about if there's a way to create either waivers or flexibility in the funding mechanisms that would allow for individuals to receive care in their homes, in a home setting, versus home and community-based versus in a nursing home, but still have either funding flow through the family to the nursing home or flow through the nursing home to the family, but figure out a way, a funding mechanism so we could help, if you will, provide care, but de-densify, if you will, during a time when we got to provide isolation. At least at the national level right now, for Scott's question, because we know that it's one of the hardest things right now for people in congregate living is not being able to see their families. But given the high risk that we have and the high risk of when you get COVID into a facility and what it can mean in terms of devastation. We saw this, I think there was an article out today about a nursing home in Moorhead where they had ended up with eight, maybe now 9 deaths in a single nursing home. 100% of the people got it. This is what we're trying to avoid. So if the question about loosening up visitation isn't really on the table right now in terms of having more people go into long-term care facilities, but the discussions with Seema Verma is how can we get people who are negative right now but might be in a facility with a positive, how can we get them out and still have the economics work for those families? So it would be, we have the same goal that Scott's talking about, which is how do we connect individuals with their families? If someone is positive, we want to keep in an area where they can get their highest level of care. If someone is negative and could be cared for outside of a home, we want to figure out a way to do that. And one of the things we have to figure out is the funding mechanism. So that's the discussion we're having, and we'll see where it leads. Okay, you guys have to decide who is first. I think they're pointing, Jack, that you can't see behind you, but they're saying you had your hand up first.
Why are the protocols for large venues only recommendations, but for businesses they're mandatory?
It varies based on back on the executive orders and which ones were under closure orders and which ones were not. And so I think that answers that question. Okay, we're going Jacob and then Lane and then Dave.
Governor, with the increased push for repeat testing and serial testing and whatnot, what does the priority look like for allocating testing resources for either repeat tests and unique testing? And to follow up on that, how do you worry about the push for repeat testing hampering the ability to see where the possible hotspots are in the state?
These are excellent questions, and let me start with the second one first. More capacity on testing is, for right now and the foreseeable future, is always going to be better than less capacity. We're very fortunate right now that in some ways in the state, I want to say, if you consider using wartime metaphors, we're fighting a one-front war, and that's really I'll call it a cast clay, because we are participating on the other side of the border. But we've got a metro area challenge right now. We don't, some other governors are dealing with 2 or 3 or 4 metro areas, or they're dealing with a metro area plus a food processing plant plus a tribal area plus we're in a great spot right now. So the discussions that we've been having as a leadership team over the last 3 days is how do we drive even more resources towards the one place where we know that there's a bit of a fire burning, and that's in Cass County. And whether that's again, not just more National Guard, how do we take staff from Bismarck that are working here where we've got very few cases? Do we get them mobilized, get them PPE gear, get them in, staying in empty hotels in Fargo, but really just getting more people on the ground to support the local Cass and Clay public health officials? How do we get more of a 7x24 operational rhythm going there? Because this can't be a Monday through Friday 9 to 5 approach. We've got to tackle what's going on there the way we've at the same level of energy that we've been doing it across the state. And if we can do that and then continue to have, you look at the numbers last week, we might only have 5 or 6 counties out of 53 that even show up with a positive case, even though we're doing a lot of testing around the state. All the clinics in the state, all the medical providers in all the cities in all the state, we know that you can walk in and get testing, but demand is low for testing. People must be healthy, and the tests that are coming in, like I said, we'll get a sprinkling. Might have 1 positive in a county. And then boom, and then we've got 80+% that are showing up in Cass County. And right now, even though that we got 80% of the actives are in Cass County, we're not yet doing 80% of the testing in Cass County. And so we've got to continue to shift resources there. But as Jacobs, you're asking, we want to make sure that if we have an outbreak in another part of the state, that we've still got the capacity to do that. But each day that we have a one-front war gives us an opportunity to try to put out that fire there. And as I said, it's not going to go out unless we get it put out in Clay County too, and that's why we're extending our resources across the border. And then in terms of the testing plans on the percent going towards serial versus the amount that would be for new individuals that have never been tested before, that's still going to be a mix. You're seeing that it's from the charts we shared today that in some days it's 40% or more is for people we've already tested before, but that is a reflection of really going after where the virus is showing up. And the virus, if it's showing up in long-term care and in healthcare workers, then that's where it makes sense for us to do repeat testing of those individuals. But we got to have the capacity to do both of those. Okay, Lane and then Dave.
Yesterday I had asked you about that study with the Abbott ID Now testing machines, and now the FDA has come out with their concerns over the accuracy of it as well. I was wondering if that has changed your stance at all, and if North Dakota is planning on doing anything different testing-wise with those machines.
No, I don't. It hasn't changed. I mean, I will continue to watch that closely, but I know that there was we checked in. I mean, you had a good question yesterday, so you learned more about it overnight. Always staying curious, but the we have 22 of the ID Now analyzers. Before, now we've got 40. We've done 702 of the ID Now tests that have come through this. We believe that based on the peer-reviewed medical studies of that machine, that test is 98% plus positive, or accurate, 98% accuracy. We know that there are other tests that, no test is 100%. And so that if you've got in that 98%, you're in great shape. Some of the other machines might be 95%, accurate. So there's a margin of error there, but we feel confident about that. The one that was originally called it into question was 100 people from an emergency room in New York City, and it wasn't a peer-reviewed study. And so the one that originally became the headline, and so I think that again there'll continue to be a debate, but I would want to make sure that we've got large sample sizes and they're peer-reviewed and doing that. And again, the thing that we're very careful and provided all the guidance. This is a machine where you do the swab, and then you put it in the point-of-care machine and run the test. And you do that right there. You don't take the swab, transport the test for a day and then run it through a machine, because that's not what it was designed for. I do think that you can get errors if you're using it in a way that it wasn't designed and licensed to be used. Dave?
This is for Nick Hacker.
Hey, thank you. There's a reason why he's a radio legend. Thank you.
Sure, Dave.
All right. 11,000 courses were offered online, approximately, correct? How are you doing follow-up with students and with faculty to see how effective they were and how you might have to make changes if we have to do it again this fall?
Sure, that's a great question, Dave. One of the things we talked about at our last board meeting was, in fact, ensuring that we're still collecting feedback from the students on their evaluation of the course. And so every course on every campus has student feedback, a formal process to that. Now, we made some tweaks to that process, but ultimately we're ensuring that we're engaging with our students as a follow-up. So I think that's something that we'll continue to work towards. I would step back and start with, we built a task force. That task force originally included the University of North Dakota, North Dakota State University, Lake Region State, and Dickinson State to come up with a guide for our campuses to reopen in the fall or to welcome more students back. We were never truly closed. We always had some students on campus, whether they didn't have somewhere else to live, for instance, or they had different needs. And so that framework then has been drilled down into new task forces that are being created at the campus levels and within groups of campuses of similar type. What happens in Bottineau is going to be very different than what happens in Fargo. And so, but part of that framework will include continued feedback and how do we measure success with our online students. It's a challenge, but it's something that will be a piece of that broader framework.
So will the board also get involved in that too?
We don't necessarily usually get involved in specific student feedback, but we will measure success of online education, and we've keyed in on several different studies. And so what we're finding is online education isn't necessarily for everyone, but it's definitely for a proportion of the populace. The real challenge is how to deliver experiential learning with some online offerings. What we know is students want some of both. It's a mix. And so that's the real beauty of the unfortunate circumstances that we've had to really evolve. We probably advanced 20 years in the matter of 30 to 60 days. Now there's going to need to be a lot of improvement in that delivery, but we'll identify and vet that out. Thanks.
We'll go online then to Jack.
In Minot. Minot is still the only large city in the state that has not had a public drive-up testing event. About 2 weeks ago, you had announced there would be an event scheduled in Minot. Do you have any ideas on when this Sentinel testing event might happen?
I'm sort of looking at my team back here. They're looking the answer up, so we'll get that to you, Gene. Maybe before the end of the conference, I'll be able to put that out. I think, Jack, you're next. Tomorrow. Hey, that was a good answer. Tomorrow, Gene, is when it's happening in Minot.
It is
Targeted for tomorrow. Okay, we'll get even more. We'll get more firm on that. We'll get back to Gene. Mike, you good? Oh, so it is mass testing, but it may be targeted at a nursing home. We'll have to check. We'll have to get back on the drive-through. Okay. I know there's been a shift away from some of the drive-through because the drive-through was, we're getting very few positives because again, we had the name which we were calling the worried well, which is that worried well, and that also included people who had cars. And so then, and could drive or had someone that could drive them. So we were hitting a percent of the population, which was maybe not the folks that were the most vulnerable or the ones that had most contact with it. And so we were, again, trying to be more targeted in our testing. And of course, we are trying to wrap up getting through having tested every nursing home in the every long-term care facility and all their staff in the entire state. I know we were trying to get through that by the end of this weekend, but Gene, we can get back on your question, but it may also reflect a shift in how we're trying to drive the resources in terms of going to where we think there's a higher percentage chance of finding positives. Okay, back to you, Jack.
Curious what your new guidance means for weddings, for couples whose wedding plans have been made uncertain, number of guests, food service, dancing.
Well, I would, again, say that I know that these are all included in the guidelines that are going to be published later tonight, and under the phase, sort of whoever, if it's your friends of yours or whoever's planning on the wedding, it will depend on the venue that they've selected because, again, like restaurants, it's a percentage of the capacity of that venue. So, again, more flexibility probably if it's outside. But again, these are guidelines that will go towards the venues. And so I would say for people maybe, after the venues who've participated in forming this, we had a subset. Now, by tonight, when it's online, everybody who's in the wedding venue business will have a chance to read them. So I would say hold off on calling your wedding venue till tomorrow, maybe later in the morning, give them a chance to read the guidelines, and then they'll be able to maybe specifically answer that question, specifically based on, because if you got a 100-person guest list for a venue that holds 250 people, you're going to be just fine. But if you're trying to get 500 people into a small space, then it may not work. So again, it depends on the wedding size relative to venue. So each individual results may vary for right now.
Do those guidelines affect churches at all?
We have, again, had kept churches separate from this thing the whole time. So again, we had just great collaboration from churches being very smart about how they were managing their regular services, whether those were weeknights or weekend. And I'm confident that they'll figure out a way to manage that through other events like weddings as well. And again, of course, we always caution, we know that if you've got somebody that is on your wedding invitation list who is an elderly and has underlying health conditions, I mean, we would encourage everybody for your loved ones, I mean, as much as you may want to have them there, I'm sure that wedding venues and churches and others, as they went to online services, are going to figure out a way to hold a wedding that is both in person and virtual at the same time. I mean, a lot of people have, love to tape their wedding. I would think we're going to start seeing a lot of people that'll be broadcasting their wedding or FaceTime living it, or so that people that may feel uncomfortable and can't be there can watch. Because I think we're in a period of time, we're not to the new normal yet. We're still in a period, as we say, of moderate risk, and so we've got to make sure that we're managing risk. And risk varies with this disease by individual circumstance. Okay, I'm going, where am I going? I'm going Dave, and then I'm going online, then I'm going Jacob, okay? I mean, I miss Lane in that one too, but I used to be a point guard. I used to be able to see everybody on the floor, and now I've got call the plays. You're up online, I think, aren't you? Yes, online? Did you have your hand up?
Oh, yeah.
Okay.
Barry Amundsen with the Forum of Fargo-Moorhead. Secretary of State Al Jaeger said all voting would be by mail and that it was too late for polling locations. Are you contradicting that?
I'm looking to our team, but I think that we're saying that it is that if you look closely at the executive orders and talk to your county officials, I think that they have the flexibility to do that. If they don't, we'd like to have that conversation and see if we can make it possible. We believe it's possible. Who's next? Dave?
At an earlier briefing, you said there were 3 nursing homes, 2 in Minot, 1 in Fargo, that were refusing testing. And you said you'd like to find out why. Did you ever have a conversation with them and find out why they were at the time refusing?
I haven't personally, and I don't have an answer for you, and maybe my team can get one here, because my curiosity remains. And then we're going, Jacob?
Governor, the guidance for larger venues unleashed tonight, when do they take effect?
They take effect, I'm going to say immediately upon being published. I mean, we're essentially, what today is May 15th, we're moving to this, by moving to this moderate level of risk, when you read in the guidelines, then effective today, then this allows for larger group gatherings than what we had before. Okay, now I'm going Lane.
Governor, you had previously said that you didn't want to discuss phase 2 reopening plans yet because it was too early. Now we're 2 weeks into reopening. What are we looking for to start discussing those phase 2 plans?
Well, I think in some ways we are, and maybe I think we're going to try to clean up our language around the use of, and move away from the words phase 1, phase 2, phase 3, and then move towards this new thing we've introduced today, where we've got the 5-level scale called, the fire danger scale, and move towards that and just say, hey, when we're at moderate risk, under moderate risk, it'll explain a set of guidelines under that of what you can do, and people will be able to look ahead and say, when we go to the next level, that's what we would anticipate. When we go to the low risk, that would involve a loosening up of set of guidelines. When we go to the new normal, it'll loosen it up even more. And so again, if you're someone who's planning a wedding for September versus a wedding for June 1st, you could probably look and sort of make a gauge and go and say, hey, if we're at low risk by September, if we're at low risk by June, then we could do X or Y based on the things. So we're trying to give people a little more forward visibility into this as well. And so I've sort of viewed today with the announcement of these groups that this is another element of loosening up that we're announcing today. I mean, it's not we are announcing some looser guidelines today with this adopting the new scale and putting the whole state at the moderate risk, because we're essentially have moved from what was higher risk to moderate risk on a statewide based on our numbers. And we'll try to get consistent with our language, but and build that into the way we're talking about it to make it less confusing. Okay, I'm going to go Jack and then back online.
Are youth outdoor teams such as softball able to practice or compete with limited or no fans?
We've stayed away from Legion baseball, high school sports, high school summer sports, all of that. I mean, North Dakota High School Activities Association is the one that made the decision about spring sports. I know there's a lot of different governing leagues for baseball, et cetera. Obviously, we had the Bismarck Larks were one of the people on the task force here in terms of thinking about large events or large gatherings, and it would be our hope that we could see some of those activities returning this summer with under the new operating guidelines, the new modified operating procedures, where you're going to be selling less tickets, assuring there's more distance, making sure that food service is managing and operating under all the guidelines for food service. But we, particularly on those outdoor things, we'd like to see people moving ahead in a North Dakota smart way. When I announced that the whole set of guidelines, I called it version 1. We know that once we've learned through this pandemic that no matter how thorough a task force is, no matter how broad the involvement, no matter how many hours they meet, at some point we've got to pull a trigger like today and say we're releasing this information. And we know that once it's out there and digested, there will be a ample amount of feedback that comes back from people saying, what about this? What about this? What about that? We'll take all that feedback, all the what abouts and all the what ifs, and try to incorporate that. What I would anticipate that what we've put out, I would call a fantastic start on a set of statewide guidelines for all the kinds of theoreticals that come up here. And then we'll take that, and then there'll be either a version 2 or a version 1.1, a version 1.2. I mean, there'll be modifications going forward as we dial it in, get smarter. Again, with the goal always of ensuring individual freedom, that we're balancing that with protecting the most vulnerable. And so again, this is about sort of the and, not the or. This is about saving lives and livelihoods. And it's also about trying to get those activities back in our lives that people love and enjoy. Particularly as we head into the summer months, this is a good time to be able to do that. Do we have an answer coming here from Jody Hansen?
Sir, Minot has elected to do their own event, and the plan is to execute tests on Tuesday between public health and medical providers in the community.
Okay, if you couldn't hear that, Gene Schemp, Minot is doing it on Tuesday. They're doing it with, I'm assuming, Ward County or Minot City Public Health, so they're doing their own event. And did they have a location?
No location noted.
No location noted, but they're doing that on Tuesday. I'm sure that Gene will be able to track that down from them. But there is some targeted nursing home stuff that I guess coordinating with the state that's going on this weekend. Anybody over there looking up the answer about the 3 long-term care facilities?
No response.
Okay, we're still looking for that one. Can you want to mask off for a second?
Yeah, polling places, they still can have a physical polling place provided the county commission meets and approves polling places and has workers, training, ballots, machines, etc. But I'm still encouraging mail ballots.
Okay. So again, it is accurately reported here that it is up to the county commission. They can have a polling place. They've got to follow the North Dakota SMART guidelines, and the county commission has to meet and make that official and then post that location. Okay, next question online, I guess. We're going back online.
Dave Kolpak with the AP in Fargo. How long do you think it will take to put out the bit of a fire in the Fargo-Moorhead area, and do you plan to visit there anytime soon?
I've been to Fargo, I think, 2 times in the last 2 weeks, so I guess, I don't know if I call that checking that box already, but happy to get wherever I need to get to help put fires out. And in terms of when I think it'll go out, I think we've got a ways to go. I think we have one of the things we're looking for is, again, execution, working in collaboration with the local level. I mean, we had hardworking contact tracers that identified 250 people that were invited to come and do contact tracing, and I think we had 78 people show up. And so then that meant that there was people who'd been identified were offered to come and have an opportunity to test, and they, for whatever reason, we need to get smarter and better about why, whether they were working, whether they were taking care of kids, whether it was the wrong time, the wrong place. I mean, this is about us learning how to do it better. This is not any criticism of anybody that didn't show up. This is us, talking about, hey, do we need to have mobile units? Do we need to go where they are? Do we need to get into neighborhoods? What do we need to do to try to reach people that somehow we're not reaching? Or maybe they didn't have an automobile. Maybe it wasn't, public transportation didn't work. I mean, we have to really think about that. Maybe they're working 2 jobs and they work at 2 nursing homes. So we just have to do a better, deeper, more thorough job of at that local level, because this, when you're trying to arrest the growth of something that is this contagious, it really comes down to, again, we've used the word individual responsibility, but we've also got to communicate it at an individual level. We have to figure out a way to do that. So we're pouring a lot of energy into trying to get even get more targeted in what we know what we want to get done, but then having the execution to make sure it gets done. So on that question, Dave, I would think that we got weeks to go on this thing. I mean, the good news is positives have gone down in Cass County the last couple of days. That's good that they're going down. We still have a lot of actives there. We want to make sure that the actives there are remaining quarantined and isolated until they recover. We've had great support from the healthcare providers. We're getting a breakthrough on what's going on in Clay County. You could never say this thing is over as long as we've got, there was no contact tracing going on the Minnesota side prior to just recently, because again, the state of Minnesota is dealing with one of the nation's largest hotspots down in the Twin Cities area. So then it's a chance for to step up and really really work on that. But I'd say we got weeks ahead of us, and I hope that it gets better before it gets worse. But as we know, it can go from long-term care into manufacturing plants, and we have risks that there could be more breakouts there. That's why we want to get after it now. Put out the fire when it's small, and we've still only got a one-front battle to fight. Okay, Lane.
Governor, the executive chair of Abbott Labs is your 5th largest campaign contributor. Do you think that's appropriate of him during this time?
Well, one thing I would say is we've done a great job, and I want to thank all the media that no one has asked a political question in the 60 days we've been here. And I want to make sure that we're keeping this non-political, because this is not about campaigning. But I would respond to that Miles White and I have known each other for 42 years. We're close personal friends. I was at his wife's funeral about 8 weeks ago, just before this whole 10 weeks ago, I guess, before the COVID thing broke. He donated 4 years ago and made a donation now at a time when I don't think either one of us were thinking a global pandemic. He was just, hey, I supported you last time, I'd like to support you again. Anybody that would think that there is some kind of I heard somebody say, well, he must want something. That is as close to ridiculous as you can get, because Abbott machinery is wanted by every state and every government and every business in the whole world. And the fact that we got some in North Dakota when maybe others didn't, when all states were clamoring, was probably because of that friendship and that relationship. And so this is about what that wasn't a plus for Abbott, that was a plus for the state of North Dakota. And so I'm grateful for his friendship, I'm grateful for his support, and I'm grateful that he cares about supporting me as a friend, and I'll just leave it at that. I mean, there's no commercial benefit for a company who's got demand for their products is so sky high that they can't even meet them. I mean, that just doesn't even fit in this. It's incomprehensible that could be part of this equation. But I'm grateful that I got friends that have stayed close to all these years that care about me and care about North Dakota. Okay, other non-political questions? Okay, hearing none. Okay, well, listen, happy Friday. Thank you, North Dakota, for tuning again. Thanks for all that are listening and watching, for your important work in helping keep North Dakota safe, helping to save lives and livelihoods. And again, thanks to all the teams in health and commerce that worked on the new North Dakota Smart Restart guidelines. They'll be available later tonight. They're up right now. They're already up. Way to go, team. They got them done. They're up, and that includes the overall broad guidelines with the new 5-step kind of what I'll call fire danger scale, where the state is officially at moderate risk, which means that there are more loosening of some of the restrictions, including for large group gatherings. And so take a look at those, and we'll plan to see you back here Tuesday at 3:30, and have a great weekend. And again, enjoy the great spring weather. Thank you. Thank you, Chairman Hacker, also for being here.